Now, Dr. Scott Gottlieb, also with us tonight. He's former FDA Commissioner. He's a CNBC contributor. Joins us now. Dr. Gottlieb, good evening to you. Let's kick off on that same theme we just had in terms of flattening the curve. Are you as optimistic as the previous guest that that is actually happening? And to what extent is it a problem that the pace across America of flattening is different from city to city, region to region, when it comes to attempting to reopen the economy?
Thank you. I think we're showing a downward trend across the country. There's certainly some hot spots, parts of the Panhandle in Florida. You look at parts of Texas, you see cases doubling every 3 to 4 days in parts of Texas around Houston. But on a whole, we're seeing a flattening across the United States and a steady decline in cases in parts of the country that were earlier to enter the epidemic. Look, I think regionally, different governors and different mayors are going to have to make different decisions about reopening the country. I think as we get into May, we're going to see sustained reductions across the United States, and we can all contemplate gradually getting back to work in a staged fashion, in a very cautious fashion, where we bring people back in stages and then test to make sure that there's not a reignition in the number of cases as a result of bringing people back together. But some parts of the country are clearly going to lag. I think there's parts of the country that have been minimally affected by the coronavirus so far. Those parts of the country might open up sooner, but parts of the country where you saw epidemic spread, like the tri-state area, I think that they're going to be a little bit slower to open up. I think we're looking at mid-May for parts of the Northeast that were particularly hard hit by this virus.
We've seen talk of potential second waves in places like Hong Kong, Singapore, Taiwan. Are you concerned about that? What lessons can we learn?
I'm very concerned. And those countries had good systems in place to do good track and trace, do good surveillance, do good testing. And the fact that they haven't been able to contain the virus and keep it at bay, and they're experiencing now a second wave. Singapore is seeing a real uptick in cases, a significant number of cases. They've now closed schools and implemented harsher measures than what they had at the outset. I think that's a concern, and it's a real risk probably going into the fall. I think that as we reopen in May and head into the summer, if there is going to be spread, it might be low-level spread. We're never going to get rid of all the cases of coronavirus. We're going to continue to have spread in this country. The goal is to try to keep outbreaks from occurring and try to contain the cases as much as possible. But as we go into the fall, there's a real risk that this starts to rebound as people go back to school, on college campuses, as kids go back to school, as people go back into offices coming off the summer. I think that that's the real risk that we face. Hopefully we have a much better toolbox, and I know we're going to talk about that a little tonight, going into the fall in terms of better testing and treatments that can mitigate some of that risk.
Well, to that point, let's talk about the testing. To what extent are we getting closer to the all-important antibody test, and what can that actually tell us when we have it?
Yeah, the antibody tests are coming onto the market. I'm not sure how important they're going to be. They're very useful as a research tool to try to discern what level of exposure the overall population's had. But once we do antibody testing on scale, we're likely to see that a very small percentage of the population has been exposed to this virus, either had COVID, had the disease, or were exposed to the infection, never got ill from it, but were exposed to it and developed some level of immunity. Somewhere on the order of 2 to 5% of the whole population, and probably at the lower end of that range. In certain hotspots, it's going to be higher, places like New York and Staten Island and Queens in New York. I would expect it could be 10, 20, maybe 30% in parts of New York City. But on the whole, nationally, it's likely to be very low. And it's not going to be useful as a sort of return-to-work tool. We're likely to find a very low percentage of the population has been exposed to this and developed any kind of immunity. In certain professions, it's going to be higher, so it can be used in an effective way to help identify who can go back to work sooner or who can be put in frontline positions. Healthcare workers, TSA agents, EMT, firefighters, police. You're likely to see higher rates of exposure in those professions, flight attendants, but on the whole, it's likely to be fairly low. There were a couple of studies out today that seem to affirm that, showing exposure in Santa Clara around 2 to 4%. In Seattle, a study showed much less than that, more in the order of 1%. I think nationally, as we do those studies, though, when we're through this epidemic, we're likely to see something on the order of 2 to 5% on the whole.